So when patients come into our office, they typically come in with a condition or a symptom that is bothering them. For example, it could be low back pain, it could be neck pain, it could be headaches, it could be a thyroid condition, it could be hormonal imbalances, it could be irritable bowel syndrome. All these things are symptoms. These are conditions or even a disease diagnosis. These are all things that patients will bring patients in to see a doctor, and if following the traditional medical model, the treatment protocols for these conditions are typically based on those conditions. So for example, a patient comes in, let's say hypothyroid. A patient comes in with hypothyroidism, and the doctor will run the lab work and they'll see, okay, we've got an elevated TSH, so this patient is hypothyroid, so they're going to put you on some kind of a T4 supplement or a supplemental hormone like levothyroxine or Synthroid or something like that. In other words, they're going to treat the condition, and that's how they're going to manage the case. But here's something that I want you to understand. We talked in a previous portion, we talked about the body's ability to heal itself, and a lot of people don't know about that the body is designed to heal itself. So there's a change in paradigm that has to happen for you to understand that. Well, here's another change in paradigm. You need to understand that most of the time, the symptom is not the problem. Okay, you got to understand the difference between cause versus symptom. Okay, the symptom is usually a warning signal. The symptom is usually a red alert. It's letting you know, hey, there's something wrong with your body. For example, if you're driving down the street and your oil light goes on, okay, your oil light comes on, that's the symptom. If you're having chronic headaches, that's the symptom. If you have hypothyroidism, that's the symptom. If you have low energy, if you have brain fog, if you have back pain, all of these things are the symptom. Just like that oil light is the symptom. Okay, so you can't chase after that symptom and try to address just the symptom. You have to go for the cause. So in the example of the oil light, if we started chasing after the oil light or chasing after that symptom to solve it, we could grab a little hammer and we could bang out the oil light and turn it off, and hey, we fixed this. This is cool. We're good. Or we could take duct tape and put it over the oil light so it couldn't be seen anymore, and then, hey, we fixed the symptom. But we didn't fix the cause. The cause of the problem is that you need to change your oil. Or maybe you got an oil leak. Or, maybe there's something else going on with the car that you need to handle that cause of the oil light. Well, it's the same thing with your body. You've got to address the causes. If you come in with hypothyroidism, why are you hypothyroid? Most of the patients that come in that are hypothyroid in our practice do not have a thyroid problem. I know that's weird, and I know you probably don't understand that, but the truth of the matter is most of them do not have a thyroid problem. Their thyroid is being affected, but it's being affected by a different cause. So the purpose is we have to find the cause. Is it leaky gut syndrome? Is it an autoimmune situation? Is it thyroid underconversion? Is it an exhausted pituitary gland? What are the causes of the thyroid malfunctioning? Same thing with headaches, same thing with back pain, same thing with diabetes, same thing with, any dysfunction in the body or any symptom in the body. You have to go after the cause. And here's the catch. The cause is different for each person. Okay, so it's March, and this is the time of year where everybody's wanting to get active because the weather's getting so much better. You can see all the joggers getting out and starting to get into exercise programs. And a lot of our patients, especially a lot of our people that have opted in for more information about our thyroid program, this is when they really start to notice the effects of how they're feeling because they can't get out there and do the things they want to, or they're not willing to go out to the beach because they're not comfortable with how their body looks and they're not confident in themselves. So we do this special in March because we want to help you reach your goals and help you get back to a normal life. So what do these visits include? Well, the first thing we're going to do is we're going to do a complete case review. I'm going to have you actually come in and share with me what your story is. I want to know detail to detail what exactly has happened. I actually have most patients write down their stories so that we don't miss any of these details because a lot of times, the devil's in the details. A lot of times we can find clues to let us know where we need to explore to figure out what's going on with you. So we're going to go at in-depth, deep case review and history with you. We're going to review labs that you've had doctors run for you in the past. You're going to bring those into me and I'm going to sit down and I'm going to review these for you. I'm going to review your case and figure out what is going on with you. The next thing is we're going to do a goal review. What are your goals? Do you want to lose 30 pounds? Do you want to just get the energy to be able to function through life, to be able to play with your kids when you get home from work? Do you want to get your sex drive back? Do you want to feel like you again? What exactly are your goals? And then we set up realistic expectations to know when those goals will be met and what might have to happen for you to achieve those goals. We're going to do a complete neurological evaluation. We've talked about how brain function is so important to the overall ability of the body to heal itself, and we need to determine, is there transneural degeneration? Are you losing neurological function and don't even know it yet? We're going to find that out. We're going to do x-rays if necessary. We're going to study what the structure of your body is doing so that we can know, structurally, is there an issue that's keeping you from healing? If they're medically necessary, we will do these x-rays and we'll figure out what, again, is going on with you. We're going to do a complete neurological evaluation. Metabolic evaluation. In the lab review that we talked about, I've got very specific questionnaires that you're going to fill out. We're going to know how your thyroid's functioning. We're going to know how your adrenal glands are functioning, your kidneys. We're going to know how your liver, your gut, how your body's processing sugar, how your brain function's occurring, what your neurotransmitters are doing. We're going to know all this stuff by the time we're done. Then we're going to sit down and we're going to go through a report of findings. And I'm going to report back to you everything that I found. You're going to learn more about yourself in that appointment, and you're going to understand more about what's going on with you after that appointment than you've ever known before. At that point, we're also going to go over any financial obligations. If you have insurance, you'll know about insurance coverages. If you have any out-of-pocket, you'll know what that'll be at that point. And then we also offer one complimentary session if you're a patient that does qualify for our program and someone that we feel like we could help you. And let me tell you right now, if you qualify for our program, there's nothing out there that's going to help you like this program will help you. If you don't qualify for the program, I'll help direct you in the right direction of where you need to go to get help. But if you qualify for our program, we're going to go ahead and include a complimentary session for you to come in and see what a treatment is like in our office, see what a brain-based treatment is like, see what we do to try to help you heal and help you get better. So this is a total of 3 visits. The first visit is where we're sitting down and talking and reviewing everything. Then I'm going to take all that information and I'm going to sit down and write up your report of findings and write up your plan for what we're going to do for you. On the second visit, we're going to sit down, we're going to talk about that report of findings. I'm going to explain to you exactly what's going on, show you what your plan is, and then the third visit, you're going to come in, you're going to get the complimentary treatment to see what you want to do. Now, the total value of these visits is between $450 and $500. That's for 3 visits in our office, quite possibly about 2 hours of my time dedicated to your case to figure out what is going on with you and what we can do about it. And again, it's a cost of between $450 to $500. A lot of times we'll offer special offers for this where you can come in and do this for discounted rates. But for March, we're trying to encourage as many people as possible to get back to normal life. So we're going to do this for $27. That's all 3 of these visits for only $27. The catch is you've got to be in here and get this done before March 28th. That's a Thursday. You got to be here before March 28th. If you come in March 29th or if you schedule your appointment March 29th, it's going to be the full fee. Okay? So give us a call. Take advantage of this. Phone number is 850-862-2224. You cannot lose. You're going to learn more about yourself. You're going to have 3 incredible visits into our office. It's going to be well worth your $27. I highly encourage you to do it. Okay? 862-2224.